Hey everybody, this is Dr. Sattler again with the question of the week. Okay, so this week's question of the week. Metoprolol 25 milligrams twice a day by mouth has been prescribed. Which vital signs listed would require the nurse to hold the medication? So we've got our first one, a temp of 98.1, respirations 18, apical pulse 88, blood pressure 100 over 68. Second one, a temp of 98.5 degrees Fahrenheit, respiration 16, apical pulse 50, BP 98 over 64. Third one, temp of 100.4 degrees Fahrenheit, respirations 20, apical pulse 100, BP 148 over 88. And our last one, number 4, temp of 99.2 degrees Fahrenheit, respiration 16, apical pulse 80, BP 96 over 76. So metoprolol is asking us which one should we hold. So first of all, we need to know what metoprolol is and what is it going to do. What are our expected or desired effect are we looking for? So we know metoprolol is a beta blocker. And so as a result, we know that that is going to lower the blood pressure and lower the patient's heart rate. So we know it's going to lower the blood pressure and lower the patient's heart rate. So this is something, remember, before giving meds, you need to make sure you understand everything about that med. And so that means, why are you giving it? What is the medication for? What are your expected response you're looking for? What are some possible interactions for that med? Should you take it with food? Should you not take it with food? What are your nursing implications? Do I need to check a vital sign beforehand? Do I need to check a lab value beforehand? And you definitely want to monitor your blood pressure and your heart rate with metoprolol because those things will be lowered. And so when we look at these sets of vital signs, knowing that it's going to further lower our blood pressure and further lower our pulse, what do we see here? And when we look at number 2, with our apical pulse, we're already bradycardic. So we're already bradycardic. So do we want to give a med that is going to further lower that blood pressure when we're already in an abnormal state? No. So our answer is going to be the second set of vital signs. We want to hold our medications for. So like I said, the answer was 2. So with the vital signs being temp 98.5 degrees Fahrenheit, respiration 16, apical pulse 50, which is bradycardic, and our BP of 98 over 64. Now, rationale, metoprolol is a beta blocker, which blocks the beta response in the heart receptors, slowing the heart rate and the blood pressure. Metoprolol should be held if the heart rate is below 50 to 60. Your doctor's orders will let you know, or you have a systolic that's below 90 or 100. Like I said, it'll all depend on your physician's orders. So you're going to follow those parameters for that patient.